Influenza, commonly known as flu, is an acute respiratory illness caused by influenza A or B viruses. It occurs every year, mainly during the winter season. Influenza viruses change their antigenic characteristics frequently, and their spread depends upon the population's susceptibility to viruses with novel antigens. Influenza is usually a self-limited infection. The typical signs and symptoms are sudden onset of high fever, non-productive cough, and severe body aches. Other symptoms are sore throat, nasal congestion, and headache. Gastrointestinal symptoms like nausea, vomiting, and diarrhea can occur, especially in children. Incubation time in uncomplicated influenza patients is 1 to 4 days, but complete recovery may take up to 10 to 14 days and even more in older patients. The differences between the common cold and influenza are subtle. For example, common cold symptoms start gradually and worsen over time, but influenza symptoms start suddenly and are more severe. The common cold is caused by different viruses, like the rhinovirus group. Common cold symptoms include runny or stuffy nose, sneezing, sore throat, mild body ache, and sometimes low-grade fever. Influenza viruses can be transmitted from person to person through hand and close contact and small and large droplets from coughing, sneezing, and talking. These viruses can stay viable on surfaces for hours, so touching contaminated surfaces and the face can also spread the virus. Influenza can lead to hospitalization and serious complications, especially in people who are considered high risk. These people include children, especially those under 2 years old, pregnant women, older people above 65 years old, people with medical conditions like asthma, COPD, heart, liver, or kidney disease, and people with weakened immune systems. Complications of influenza include pneumonia, cardiac complications like MI, multi-system organ failure, and concomitant infections. Every year, flu vaccination prevents illnesses, medical visits, hospitalizations, and deaths. It is also an important preventive tool for people with chronic health conditions. While some people who get vaccinated still get sick, flu vaccination has been shown in several studies to reduce the severity of illness. Flu viruses are constantly changing, so flu vaccines may be updated from one season to the next to protect against the viruses that research suggests will be common during the upcoming flu season. Your protection from a flu vaccine declines over time. Yearly vaccination is needed for the best protection. Now let's talk about the different types of influenza vaccines. There are several licensed and recommended flu vaccine options. Most influenza vaccines are quadrivalent, meaning they contain 2 influenza A and 2 influenza B antigens. We have 3 main types of influenza vaccines. The first type is the inactivated type, which contains killed influenza viruses and is incapable of causing illness. These vaccines are either egg-based or formulated in a cell culture. The biggest differences between these two are that some people are allergic to eggs and cannot use egg-based vaccines, and the other one contains different strains of influenza A and B. Recombinant influenza vaccines are produced using recombinant technology. This method does not require an egg-grown vaccine virus and does not use chicken eggs in the production process. There are different types of vaccines that contain both hemagglutinin and neuraminidase antigens, or just one of these antigens. Live-attenuated influenza vaccines, which are egg-based and administered as nasal sprays, are made of weakened influenza viruses. These vaccines are approved for healthy non-pregnant individuals between 2 and 49 years old, even though these vaccines are contraindicated in immunocompromised patients. General advice is to vaccinate all individuals above 6 months. A single dose of vaccine should be administered annually, and it is not recommended to take more than 1 dose a year. The ideal time of administration is prior to the onset of influenza activity, which is by the end of October in the Northern Hemisphere and April in the Southern Hemisphere. The choice of vaccine formulation depends on age, comorbidity, risks of adverse reactions, and contraindications. In all healthy non-pregnant individuals below 49 years old, any inactivated or live-attenuated vaccines are appropriate. But for individuals below 49 years old and contraindications to live-attenuated vaccines like immunosuppression, chronic cardiovascular diseases, pulmonary or metabolic diseases, In pregnancy, any inactivated vaccine should work. For individuals above 65 years old, high-dose or adjuvanted inactivated vaccines and recombinant vaccines are recommended. Influenza vaccination is contraindicated in patients with a prior history of a severe allergic reaction to an influenza vaccine. For patients who are taking anticoagulant medications, a small gauge needle should be used, and firm pressure to the vaccination site should be applied to reduce the risk of hematoma. For individuals with a risk for influenza complications, the small risk of vaccine-associated Guillain-Barré syndrome is likely outweighed by the benefits of influenza vaccination. Furthermore, influenza vaccination may reduce the small risk for GBS that can be triggered by influenza virus infection. For individuals with a prior history of GBS who are at risk for influenza complications, we favor proceeding with influenza vaccination. Many defer vaccination more than 12 months after the onset of GBS. For those who are not at risk for influenza complications, it is reasonable to forgo influenza vaccination. Thanks for watching this video. I hope you enjoyed this video. If you did, please like, comment, and subscribe to my channel. See you in the next video.